So muscles of hind limb of goat, where we can see on the lateral aspect, this is the tensor fascial lata triangular muscle. This is the fascia of the tensor fascial lata muscle which forms on the lateral aspect. Then here we are having this one, biceps femoris. In this position gluteus medius and gluteus profundus is present, but here it is only left, small part is left. Then this is the semitendinosus muscle on the lateral aspect. This is semi tendon like muscle, this is semitendinosus muscle, this one. Okay, then next is medial aspect. So medial aspect we can see here, this is the strip or ribbon shaped muscle sartorius, and then gracialis which covers the muscles of lateral aspect, this is gracialis. Then here we are having this pectineus, this one is pectineus, this is adductor, and then this is extensive muscle, below this is the semi-membranous. If you reflect it, and we can see this one is semi-membranous muscle. In the femoral canal we can see position of saphenous nerve along with femoral artery and femoral vein which is passing in the femoral canal like this. On the anterior aspect we can see, this is anterior aspect, we can see quadriceps femoris. This quadriceps femoris, large muscle, rectus femoris having 4-part, rectus femoris, vastus medialis, vastus lateralis, and in between if we cut from here we can see in the position, if we cut like this then we can see vastus intermedialis. Then muscles of anterolateral aspect means extensor muscles. So first is we are having here this peroneus tertius muscle. This one is peroneus tertius which is tendinous in case of horse, but here it is fibrous or we can say muscular in appearance. Next we can see here long distal extensor. This is long distal extensor is having two bellies, one is medial belly and one is lateral belly. So this is long distal extensor muscle. Below this you can see this is long distal extensor muscle having another belly is this one. Next towards this aspect we can see this is the cranialis tibialis muscle. This one is very thin small muscle and elongated in appearance. This is cranialis tibialis muscle. After that this long distal extensor distally the form of tendons we can see here, this is the retinacula. This is the retinacula one and another is present in this position. Then this is the tendons. So this one is a tendon of this peroneus tertius. This one is tendon, and another we can see this long distal extensor having two tendons. These two, one is lateral and one is medial, these two. And here we are having short distal extensor in this position, and extensor brevis is also present. So here you can see in this position these muscles. Next thing is the cranialis tibialis. So this is the position of cranialis tibialis, and this one is the peroneus longus. This is the peroneus longus muscle, and then we are having this lateral distal extensor. This is the lateral distal extensor muscle. This is the lateral distal extensor is going up to the level of metatarsal. Then here we are having this deep digital flexor, and then here in between the two head of gastrocnemius, this is gastrocnemius. So this we are having in between them, this is the superficial digital flexor, this is the deep digital flexor, and in between them this position we are having popliteus muscle here. So this is the popliteus, this is the deep digital flexor, this is the deep digital flexor, and this is gastrocnemius, and then this is the superficial digital flexor. Then this superficial digital flexor in this position is having soleus muscle. This one is a small muscle of the very small in shape. In this position this one is soleus muscle which is very small and which assists the gastrocnemius. So this is the gastrocnemius muscle. Then we can see here this is the bursa, Tacanian bursa. So Caninian tendon we are knowing that this is the Achilles tendon or Caninian tendon. Cunian or calcanean. This is calcanean, not cunian. Cunian tendon is another, that is the medial branch of cranial tibialis muscle. medial tendon, medial insertion. So this is the calcanean tendon or Achilles tendon. This is calcanean bursa. This is the point of Hock. So we can see here, this is the forming by the help of superficial digital flexor and the tendon of gastrocnemius muscle. Next thing is nerve supply. So this we can see here, this is the popliteal lymph node, we already told. This is the sciatic nerve, which is dividing into two. One is going anteriorly like this, it is known as fibular nerve or peroneal nerve, common peroneal nerve, which is having two branches, superficial, one is deep supplies the extensor muscles. Then another is, this is tibial nerve, which is passing in between the two head of gastrocnemius. This is the lateral head, this is the medial head, metatarsal artery, and then dorsal digital arteries. Then what about this nerve? This nerve, this tibial nerve is passing between the two head of gastrocnemius, and it divides at the level of this tarsal canal. It is forming in the position of this, it is coming here like this, we can observe here in the between the deep here and in front of the Achilles tendon, it is coming like this, you can see this, and then it is passing in the tarsal canal and then divides into lateral and medial plantar nerves, supplies the digits. So this is about the tibial nerve and fibular nerve. This is coming from the sciatic nerve. Then this is the fibular artery, which is giving, and popliteal at the region of proximal end of tibia popliteal, then dorsal pedal, then metatarsal, then dorsal common digital, and then medial and lateral digital arteries. Then one of the branch of this is artery is going towards the medial aspect of the stifle joint. So this is the lateral medial aspect, that is known as saphenous artery. Saphenous artery is again dividing into medial and lateral plantar artery, and supplies the region of digits. So this is about the nerve and blood supply along with the muscles in the goat hind leg.